We have no public questions and no member questions. We're now going to look at the recruitment and retention of social workers report.
And I'm just going to introduce that. So this report was provided. Oh, sorry.
Yes, they can't hear on screen.
Okay. Apologies. This report was written by Sam Williams, the Assistant Director for Workforce and Improvement, and the purpose of it was to really just update committee on the recruitment and retention of social workers. It continues to be challenging, particularly in children, and that seems to be the main focus of the report. I haven't written it, but I'm happy to take any questions that you might have.
Okay. Thank you, Danessa, and thank you for stepping into the breach, because I know Sam's got COVID as well. So we've been talking about this for a long time, and obviously it's a problem for all councils, and I think that's come out in the report. But I just wanted to ask you to talk really to my question. So in the report, it talks about a memorandum of understanding in the West Midlands, where 14 local authorities have all agreed to sort of pay the same. But then 11 of them have found reasons not to pay the same. And so we're in this position where some people pay more than others or whatever. And in amongst this, and this is a bit technical, so I don't think I have the answer to it, but every authority has different terms and conditions as well. So it's not just about the memorandum of understanding, which clearly none of them are following. It's about the regularisation of everyone's terms and conditions, which would be practically impossible. But there is talk about the Department for Education capping agency workers' pay, which would probably give everyone a fairer chance of recruiting people. Because essentially what we want to be able to recruit people, to have less agency workers, because it's better outcomes for the children, and also it's cheaper for the council. So if you could talk to that bit, and it also follows on really that whilst the DFE is talking about the children's capping, you've also got, I think it's ADAS, which is the Association of Adult Social Care Directors. They're sort of following in the wake. So hopefully there might be a little bit of light at the end of the tunnel for everybody if everyone worked out a cap.
There's a long and a short answer, I think. And maybe you might want to speak to the adult side. But in terms of just going back to what you were asking about the memorandum of understanding.
Yeah.
So the memorandum of understanding is an agreement that all 14 local authorities, West Midlands local authorities, have agreed to. They've all signed up to it, and actually should not be paying over the agreed pay rates. But there are local authorities, particularly those that are struggling, who can request to pay outside of that, but you shouldn't be doing that without the agreement of the collective. So I'm not aware that there are some. I heard what you said, that there are a number that aren't complying with that. And I don't know the sort of the rationale behind that, but really you should not be going outside of the memorandum without the agreement of the collective. And it will be particularly local authorities that are inadequate and can't get social workers. So sometimes there are agreements, well, the agreements can be given for you to pay over and above to actually get workers in.
No, so really, without some sort of government intervention, we're not going to solve that situation, because we're in an upward spiral. And the problem is, well, I don't know, it's a pressure. If suddenly 1 month an authority puts the money up and it's quite close to the other authority, then people will just go and work in the other authority. And so that's catastrophic for the children, because obviously they've got more change, and also for the local authority, it obviously adds a considerable burden to to them.
And I think that obviously has been recognised by the DfE. They are putting plans in place to look at capping social work pay so that there isn't this ever increasing pay scale, which no local authority can sustain in the long term. But the government actually haven't made a final decision on that as yet. So we're still sort of in a bit of a lull around what's going to happen really in terms of social work pay, in terms of agency pay.
So that might well be something that we could ask Cabinet to progress.
Yes.
Okay, thank
That
you.
would be helpful.
Thank you.
Duncan?
Yeah, I was also interested in the memorandum of understanding and how much that is a constraint on our ability to attract and retain social workers. What's missing from my perspective on the report is some analysis of people who do leave the council. Where are they going? Because what I'd be concerned about is if they're going to a similar job in another authority that's paying more, well then clearly we've got that could start to give us the evidence base for saying we need to address that. At the moment, I just don't know from this report whether that is the case. I see we've done something to enhance basic pay with some retention payments and adaptive payments. I see other councils have done that, who have got the memorandum of understanding. I suppose the question might, should we need to flex up a little bit more, increase that? Because obviously when a council comes under a little bit of criticism, and I put ourselves in that bracket, but certainly not in the bracket of other councils, but it doesn't help. In terms of recruiting and retaining staff, so it may be we need to adjust that. So the first thing I'd like to say is I would like to see analysis of leavers to see where they're going and where there's evidence that. Then moving on from that, and we discussed this a bit, I know, on the Children's Improvement Board, is obviously one of the surest ways of getting a sustainable workforce is to grow your own. And we've got a programme for that, but I think it's around 7, I think it was being said. And it clearly was being suggested that could be doubled. Well, I don't understand why it hasn't been doubled and more some, because clearly the very best way is to get local people trained as children's social workers or adult social workers, because they're far more likely to stay, having been local when they trained in the community, than people who come in and then move on elsewhere. So my other suggestion would be we really look at turbocharging that programme so we can get ourselves a good supply going forward. Thank you.
Can I just ask a quick question, please? Ruth, before you.
Oh, right. Sorry, I didn't realise you.
Thank you, Chair. I think, first of all, the report's very comprehensive, and having spent time with the Children's Improvement Board, perhaps a wider knowledge of some of the background information to this. But I think the talk around the use of agency staff is much more complex, because there has been challenges with agency workers not submitting to their notice periods, leaving with a week's notice, or if any notice at all. Some workers prefer the flexibility of agency contract work. So I'm sort of more interested really in the consultation, and I know we haven't had the results from that yet, that has happened nationally around the use of agencies. And has there been any improvement locally in retaining the agency workers we have? I see they're converting to full-time posts or permanent posts, which is excellent. But in managing that sort of poor practice of agency workers just leaving without any notice or the week's notice, because I'm sure it was happening in children's. I suspect it may happen sometimes in adult social care. And what are we doing locally to prevent that? And you mentioned the capping of social work pay rates. Will that apply to agency staff as well? Is that your understanding?
Agency rates.
It is only on agency rates. So local authorities could still set their own rates of pay for social work.
Yeah.
Okay, that wasn't quite clear there. Right.
The capping is because it's the competition, isn't it? So some social workers will prefer to be with the agency because they'll get more money. What the government's intending to do is to bring the rates more in line. So in terms of the benefits that you get from being permanent, that technically outweighs what you will get as an agency, because as an agency member of staff, you don't get annual leave if you don't get paid if you're off sick. You're not entitled to annual leave. So there are better benefits of being a permanent employee. The challenge is at the moment that you're getting much more money if you are an agency worker.
The conversion rates, 17 from agency to permanent, it's very commendable actually. But are we still experiencing agency workers who leave without any notice or with limited notice?
We are, and I would say the agency workers that we've converted, what we've been able to show them is the benefits of being a permanent employee in terms of sick pay. And we've worked with HR to do some financial analysis of what it actually means in your pocket when you become a permanent member of staff. And that is what's attracted some agency workers to become permanent. And so what was your other question?
Or whether we're still experiencing agency workers who leave without serving that full notice?
We are still experiencing those. But mainly those are the workers that we, the quality of their practice is poor. Children are, I would say that children are not getting the best service from them. But what we would want them to do is to still work out their notice to ensure that any information that they've got is recorded on the child's file. Where that's happening, where people are leaving at short notice, we're actually referring them to social work in England because that they're actually breaching. Yeah, they're breaching their social work standards. So we are sort of making those referrals into social work in England.
Thank you.
Kirsty?
Good morning. Yeah, a lot of that was covered yesterday, Ruth, at Children's Improvement Board. Unfortunately, you couldn't attend. So a big thank you actually to Ruth. I don't know if Tony's in the room and Duncan, who sit on the voluntary Children's Improvement Board with me. And we did discuss a lot of this yesterday. We did also put on record our thanks to Sam and the team for all the work they're doing and at speed to look at this area. A lot of work has gone in on comms. Don't suppose anybody's not seen the adverts come and work for us. Just to give some reassurance about the agency, back up what Danessa's saying, if they're not up to scratch, they're gone. We have these high standards and for a reason. We want the very best for Shropshire children, and that is what we are continuing to aspire to, and we are still a good authority, and we're looking at this area intensively. But we also challenged back, didn't we, Duncan? And sorry, Ruth, you went there, but we challenged back. So what now to Sam? It's unfortunate she's not here because yes, it was a great conversation. It's a great amount of work, but we need to know the impact and the time of that impact. Where are we going with this? How long will it take to recruit? I know that's a golden question, but we really need to understand the impact of what all the work they're doing and the speed. And if I don't think Tanya's in the room, is she? She was impressing the same thing as well at the board yesterday. So it's to give some reassurance that the board's really doing its job away from scrutiny, and that we are, really working hard. And we've had some really good successes, and it's really good to see the agency rate coming down and people coming over to us permanently. And that's the the great work that Danessa, Sonia and the team are doing. They're showing the value of coming to work for Shropshire Council, which is brilliant. I will take forward your comment about the pay cap, and that's something I can pick up with Cabinet. So if you want to put that down as an action, Peggy, as chair, that I will take forward absolutely and speak to Cabinet about. Thank you.
Thank you. Good.
Yeah. That's very interesting to know that there is someone else discussing the same things as we are. Mrs. Gray, I think we've got this agency thing that came through because I was in hospital just around about COVID. The agencies people were earning an awful lot more money, doing less work, actually. Some of them during the day were working just as hard, and I got, thank goodness I nearly lost my leg, and that was an agency worker that found that there was something wrong with it. But if the staff that we have, you need to do what you've just said, is to make sure that they're going to be there to give you that information and not to go off and go somewhere else. And I don't think maybe we should have a policy with agency staff where we get them to sign something that they've got to stay that little bit longer to give you that back information. I don't know whether you're doing that or not. Sorry.
That is already in place.
Right, thank you.
In terms of the memorandum of understanding,
Yes.
that is already in place. That work it's now increased to 4 weeks. 4
Yes.
weeks notice. They should be giving us that. But there are workers that don't comply with that and they just give immediate notice and they're gone.
I'm sorry, I haven't got the notes. I was turned up during the last few weeks,
Okay.
so I've not had anything at all. And I did ask for it, but I'm afraid they're off with COVID. I personally think that the children's situation, we had a man called Liam came last year. Has he gone? Is that man not working for this council anymore?
He didn't work for this council, he was from the NHS, wasn't he?
Oh, right, yeah. But I mean, he sat there and he was in tears, actually.
Supposed to
about,
come back,
you
actually,
know,
but
Yes, well, I would like to see him again because that would be really interesting, yeah. So, yeah, I think you're saying the right things, but unfortunately, these people know they can make a lot of money out of this. So I'm sorry you're not going to change it that quickly.
Kevin?
Thank you. Growing our own is obviously the best way forward, I think, because it does, link to loyalty and staying in it. But I'm not sure how it's financially supported. Does the government subsidise in any way? And with the news we've received this week about having more cutbacks, will that affect the scheme?
So the Grow Your Own scheme is it's an apprenticeship course, so it's paid through the apprenticeship levy, is my understanding.
Okay.
Up to the point where they qualify.
Great. And so it won't be affected by?
No.
Great, thank you.
Alex, I think you were next.
Well, on the same topic, of course, growing our own is the really important thing. Obviously, University Centre Shrewsbury was doing some social work training and social work apprenticeships. Do we think that's going to have any discernible impact on recruitment, given that for them pretty shortly?
I don't think so, because I think if growing our own is the only way forward, and that's what we believe, then we're going to have to negotiate with, and I'm sure that's already in place. What I will do is I will sort of clarify that bit of information and I'll get back to you. Yes. Yeah.
Do you want to come on that?
Yeah, I can. So just to confirm, in adults, I think we've recruited 100% of the apprentices into vacancy social work posts over the last 3 years. We've got 6 apprentices this year, which is the biggest number we've ever had, because we've managed to secure more funding through the apprenticeship levy, which is fantastic. We have a new university already identified. I think it's Leicester or Coventry. It's one of those. So forgive me, I will definitely confirm, but I think it might be Leicester. But we did have confirmation of that yesterday. So we've definitely got a new university in place ready for those new students starting. They're literally starting in the beginning of September, so a few weeks' time.
In addition to things that my colleagues have been saying, the other thing that we are trying to do is to put an infrastructure around to support social workers. So, for example, we're going through a current business review. So the business review is looking at what are the roles and what are people doing in terms of time and activity. So what we want to be able to do is to take off some of the tasks that social workers shouldn't be doing, don't need to be doing, and making sure that we're not duplicating. And I think part of that is to ensure that when people are coming in to work for Shropshire, that they know that they're doing what they should be, what they're trained to do, what their role is, and they're not doing those added additional tasks that, currently probably is happening, I think, if we're honest. So that is something that we're currently working through at the moment, and that's across both adults and children's. We've already done a lot to date. I think we've been here previously to the committee and talked about, how some of the tasks that we've been taking off them in terms, especially for adults, around the negotiation with care placements as an example. They don't do that anymore. That's something that the brokerage team are doing. And again, we're growing the brokerage team as part of where you'll see in the next report around the commissioning infrastructure. The idea is growing that to support the operational team for both children and adults as well. So it's because it's not always about money, it's about, the experience that they're getting when they are working here, which is really, really important. And we know that from the provider market as well. So just wanted to point out there are additional things that we are trying to do to ensure that, we are keeping people in place.
And just to add to what Laura said, social workers, when they come to Shropshire, they want to stay with us. We've got workers in the service that have been working with us for over 2 years and they live at distance. So it is a good place to work. And so we do want to continue to encourage through the Growing Our Own scheme, more workers into the service.
Duncan.
Yes, some of you probably know that I trained to be a children's social worker late in life and worked at a number of councils. But one of the things that struck me about the role is that it's a role that needs an integrated team, so you're very reliant on all other agencies around you. But secondly, it's a role which is quite difficult to relate to the rest of the council because of the confidentiality. So we all know about planning, we know what plan officers do, we all get into detail of a planned application. We can't see that same detail of a child, of a family, because it's all confidential, and that's absolutely right. But what that led me to think, and working particularly for Leeds, Leeds is a very it's the second largest social work team in the country, but it's got an outstanding reputation for children's services. And I think that was partly based on the fact that, I don't know for what reason, but early on Leeds made a decision that children were going to be an issue for the whole council. So they had this child-friendly council ambition. So it wasn't just children's services who were concerned with children, it was people in economic development and housing, and everybody knew broadly what the council was trying to achieve in this area. And for people attracted, clearly, people who work in children's services are going to say all the right things to people who want to come and be a children's social worker. But at the back of the mind, they would say, well, what's the rest of the council think? Because it's the rest of the council setting the budget and setting the directive. And how much do they see children's services or adult services as important to the whole council? So I mean, it's a sort of cultural issue, and it's something resolved easily. But I think if you want to attract, to do the best attraction, it is worthwhile considering having a clearer concept of why children's services are important to the whole of Shropshire, to every council in Shropshire, whether they're on People's Scrutiny Committee or not, and what the role of all the other departments actually is, and have a methodology about what it means to be working in children's services in Shropshire, the Shropshire way, and those sorts of terms. And I'm not saying we haven't done anything in that arena, but I think we can do a bit more in that arena. And that just creates a visual. I'll leave them.
Food for thought. Yes, please.
I think you're absolutely right, Councillor. And I think, we talk about the one Shropshire, don't we? The Shropshire plan. And I think we're trying to move to that concept of this one way of thinking. I know, particularly as SSADs, we meet fortnightly. One of the things that we're trying to do is look at collectively how we protect the vulnerable and social care frontline services. That is absolutely key for the organisation. But I think you're right in terms of that wider commitment. Maybe we need to think about how we do strengthen that in terms of the so it's going down at all levels. I think it's there. I think we've done a lot. I think we've moved forward quite a bit over the last couple of years. And I think that is part of that Shropshire plan, isn't it? And that we're all embedded and committed to do. We'll be thinking about the Shropshire plan ends, I think, is it 2025? Should know this, but it's so it's coming up for, we all need to think about what that looks like moving forward. So perhaps that's an opportunity for the committee and cabinet to think about how we ingrain that across the organisation. So very
good. Thank you, Chair. I'm just looking at table 7.16 around the retention, the annual figures for turnover for children's and adult social workers. And children's has significantly improved. Adults is still at, although it's improved, it's still at 9.8 compared to 3.4 for children. But then looking back at 7.12, I note that there was a payment made to children's social workers of 7,500 retention for 2 years. Is that going to be applied to adult social workers as well, so that it's a level playing field, and also to improve on the retention rates or reduce the turnover?
I don't think it is.
I can come in, yeah. It's currently doesn't apply to adults. There's no intention at the moment to do that, because our recruitment is more fluid than children's. We are able to attract social workers, and vacancies aren't open for as long. There's been a definite change over the last 12-18 months prior to the difficulties. The main area we struggle with recruitment is the hospital social work team, which is where our higher agency numbers are in adults. But we've got a future plan to kind of try and combine and look at, can we do more around the community element of the social work team in hospitals, and see if my area adult social care communities can do more and fill some of those voids over in the adult services in ICS. So yeah, it doesn't apply at the moment, but it's definitely been discussed.
Okay, thank you. So the the annual figures for turnover, we're expecting that to get down to the level of children's social work turnover as well. That's correct.
I think so. I think, with growing our own, as I say, we're filling vacancies with people that we've trained up that have normally worked in adult social care in Shropshire for a long time as social care practitioners, and have then had the opportunity to go into the apprenticeship scheme. We don't recruit into apprentices from external to already working in the service. So that means that they've got a clear journey of progression. A number of our seniors and team managers were apprentices as well at one point in time. So we do see retention. I think the ones that tend to come and go a little bit are the kind of more experienced social workers, unfortunately, that have worked in lots of other areas, and generally will move because of the money paid in other local authorities might be higher, potentially.
Looking at the turnover, and that's some of the sort of, I'd like to see a bit more sort of digging into the turnover and how many staff leave within the first year or the first 6 months in particular, because that's where the costs are around recruitment and any induction and training. So a breakdown of when staff leave, whether it's within the first year or particularly within the first 6 months, I think would be a helpful indicator around managing costs particularly.
Yeah, okay.
I can ask Sandy that.
Claire? Oh, thank you. A couple of more things from the report. I think it's 7.13. And this is something that I think the whole committee could perhaps help with. One of the things we're talking about is setting up hubs. Now, obviously, the hubs have the advantage that people have to travel less, the clients and the staff. And I think that's something that we could all perhaps contribute to. I know that if a facility is attached to one of our partner agencies, so the police, the fire, or the hospital, then those facilities are free. But there are quite a lot of quite good community facilities around the county, and certainly I'm sure that people would, if they knew that we were looking for these hubs, they perhaps would discuss it and come forward, because it would benefit our communities so much to have that kind of hub there. Even if it's only, one morning a week, it would be infinitely doable. So, personally, I think that should be one of the ideas that comes out of the committee, that actually we try and help, because that's going to help everybody. And the other thing on that sort of, on the recruitment stuff as well, is that obviously Shropshire's the third largest inland county. So it's expensive to travel to places. Currently, the HMRC only paying 45p, I think. I mean, excuse the pun, but is there any mileage in actually us lobbying the HMRC to up that rate? Because anything we can do to make it slightly more attractive. So if the social workers not only had a local hub to go to, so there were less travel time, plus they got, say, 60 pence a mile, all those kind of things, I think, would help.
Social workers we already have hubs that, because we've got our early help, some of our early help hubs that are already up and running.
Yeah.
Oh, sorry.
It is, yeah. You've got to get a bit closer, I think, Vanessa. Yeah.
We have early health hubs that are already live. There's one in Oswestry, Shrewsbury, and this one in Ludlow.
Yeah.
And our social workers can base themselves already in those hubs to reduce the numbers of mileage. And the way that we allocate work is we try and group families wherever possible, so that to reduce the amount of travelling that social workers have to do. I think lobbying government is great, but obviously it's that mileage is set by government.
Yeah.
And it would have wider implications across the whole country. So it wouldn't just be a Shropshire thing, it would be a whole country thing. And it's, I can't speak for the councillor.
Okay, I wish you could. So just going back, because obviously going back to the hub thing. So for instance, from here to Cleobury Mortimer is an hour and a half. You know, so I know you've got one in Ludlow, but certainly the south of the county, you know, because it's huge and it's very dispersed. I mean, possibly, you know, another couple of options in the south. You've got, you know, Market Drayton in the north as well as Oswestry, because that's a fair select from here as well. So just a couple more, if we could assist in any way to facilitate a couple more hubs, you know, with that. Yeah.
So we have got hubs in quite a lot of other places. So
Yeah.
adults do Let's Talk Local hubs where we have set appointments to see people that perhaps potentially on the face value of the referral, they don't need a full assessment, but they need a little bit more information and advice than what our FPOC, the First Point of Contact Centre, can give. So they're scattered all over the county. So most of the market towns have got them, and we are linking in with the family hubs as well. So on set days during the week when they're there, we've also got adults based in some of the hubs so that we can look at that whole family approach and support all generations that might be involved in that family and potentially any kind of issues around the child. So we are linking in across the service to provide those in many areas. Public Health are working really closely with that, and they're supporting. So we've recently set up ones in Highley, in Bishop's Castle. There's different locality based hubs as well, and we're looking at increasing them across, especially the south, because you say there's lots of black holes in the south and the north. So, but generally Market Drayton, Wem, Oswestry, Shrewsbury centre location, Bridge North, Craven Arms, Highley and Ludlow. There's quite a lot of activity around adults and where we're trying to merge in with children as well.
Certainly through our early help, we're trying to take the offer into the community.
Okay, because I think the hubs will help, definitely help you, you know, it makes it better for the staff as well. Okay, thank you.
Can I just put a plug in for Whitchurch? We've got our new doctor's surgery opening this autumn.
Yes.
And there's loads of rooms in there, so.
We've already been in contact with the boundary.
Right. Viv, can I just a quick one? I picked up a lot of dissatisfaction about Connects, one of our housing team in Ludlow, whilst I was doing the election, I'm afraid. They are not helping some of the people in Sandpits, which is a very deprived area in Ludlow. But the new hub, I think, will help. But if we could get the connectors to work with you a little bit more, I think you will pick up a lot more, because people were coming to me during the election and saying, I'm sorry, but we are very dissatisfied with what's going on where we're living. You know, it's very hard for people to be moved to the extent that they are being doing, and also some of the things that are happening up there, electric being turned off, nobody speaking to them about the children, we're having a lot of problems with. I caught 4 children breaking into a house that were from Sandpits the other day.
Can I make a suggestion? Yeah. You contact Councillor Barrow, because housing comes under that scrutiny.
Yeah, but you know, it was something I just picked up. People just coming and speaking to me.
It just might be worth it.
Yeah,
to get it to those scrutiny.
Okay. Can I just finish off by saying that one of the things where the house that was broken into was somebody that you have in a nursing home in Shrewsbury. She's been moved from one nursing home to another. I'm not sure about her name, but I know she lived in Teamside. I had to have the place, somebody had to come in from the police and secure it. That's how bad it was. You know, I really honestly think that the woman didn't know where she was being moved to. She was being moved all over the place. A lot of dissatisfaction about this council from her. And she said that she's now back in Shrewsbury, but she was very dissatisfied where she was sent to, which was, I think it was quite a long way away from where she'd been. And she has not got dementia, but every single person that was in that nursing home had dementia. Now, that's not right. It's not right that she was put in a nursing home, all of them had dementia, and she hasn't got it.
Don't think we've got an answer to that. And if you find the lady's name out.
Yes, you see, I've not gotten involved that much. I kept saying, if we give me the information, but she wouldn't do. Because she said that Mrs. Gray was sorting it out.
Right. Not for
It would be adult
Yeah.
services.
Yes, adult services. Sorry. And I thought it was you as well. I thought you did the balls.
I know I made a plug at our last meeting, but please don't forget the Harscott Grange Community Hub. Because we just about break even. We're keeping that hub open for the community, and it is a very deprived area, and it'd be an ideal centre for you. Any extra money so that could be great for our community hub would be great. Well, leave with me first, and I will put you with the right people. Yeah.
Yeah. Oh, thank you. There was one thing I didn't ask, and I think it's a fairly common theme through both the reports, and that's the length of time it takes to get the DBS checks, because that does impinge on the recruitment of social workers sometimes.
It impinges on everything at the moment.
Yeah, and so what? Just for completeness, I was going to mention that in our recommendations, just so that we can try and lobby the national. I think it's the national police.
I thought it was.
Yeah,
to actually. Apparently, it isn't, is it?
No.
Disclosure and barrings.
Pardon?
Disclosure, barring.
You haven't got your mic on.
Oh, sorry. The disclosure and barring.
Yeah, the disclosure and barring service, because quite clearly it does impact on recruitment, and that's why I was trying to tease out of the whole thing. Anything we can do to assist in recruitment and retention, and that is one of the things that I think we could do.
Well, it's so frustrating. We had to cancel the last foster panel.
Yeah.
Because the DBSs hadn't come past. So you've got the people there wanting to foster, help our children. We can't use them because we haven't got the DBS. I swore, sorry. It makes me so cross that they take so long. Can we lobby anybody? Is there anything we can do?
I mean, DBSs are outside of our control. We submit those, and then they come back when they come back, and you can. And you actually can't chase it for a certain period of time, which doesn't help.
I
don't know who.
No, I think we certainly raised the issue because I think it's something that goes across both reports and clearly is important to children and adults.
Right to the police is now. I think it's a police thing that need to be done.
We need to do that as well.
Yeah, I think we'll find out. What the delay is, but I think it is. I think it is resources. I think on the police side that's causing the delay. I don't know that for a fact, so I will confirm that is the case. And I think I'm sure that we'd appreciate support from the committee and cabinet on that, because it does have such a significant impact. And it's not helping at all.
It just makes you so cross because the staff have done their best to get everything there, and then this is what lets you down.
I was a bit surprised to read that, and I'm assuming there's a difference between basic or enhanced checks, because having applied for a basic check only about a month ago, literally within 2 days I got it. So I'm assuming it's because
it's really enhanced.
Yeah. I wonder whether I've read somewhere in some papers whether sitting with a member of staff at the recruitment stage to make sure everything goes in is one area where it could be speeded up. But I don't know. Do you know where the delays are? Are they fine at the minute they're appointed or offered the job, and I'll be supporting members of staff to get everything in, ordered the members, potential member of staff, sit on it for a couple of weeks, and that's just that stuff today. I think we need to know that detail and then put in the appropriate action. Because if the delay is this end, then we could do something around making sure it's done timely.
I was just going to say, I did speak to Sam Williams last week. I regret it now because it's face to face. She's got COVID. But she did say that our bit's okay. It is actually the police end, Ruth, because I asked her that specifically.
And it's because they're enhanced.
Yeah, it's because they're enhanced, yeah. And that's what's taking time.
And there will be certain points of the year when, particularly around sort of September time and other points where there are, they're getting teachers and social workers through, where it will take a bit longer.
We receive periodic updates from the DBS service, essentially like that says we are still experiencing these ongoing issues, particularly around enhanced. So actually the issue isn't our end, but it, like I say, affects the teaching workforce, teaching assistant workforce, etc., etc. So it is a challenge with the DBS service themselves and the police sort of things.
Average time to getting one approved then for an enhanced check?
It varies. I think sometimes it can be a matter of weeks if it all goes well. But if they have to then do some further checks and balances of what people have moved areas, it can really be quite extended. It's a frustration, and because we can't see inside the black box that does all this stuff, we don't know where the challenge rises.
Yeah, I think I was told up to 2 months, Ruth.
You're quite pleased, I got mine 2 days.
So is there anything this committee can do to help?
I think as Laura's described, I think a letter to the DBS service and the police would be the most appropriate.
Everybody happy we do that?
Can I just add a couple more suggestions, Becky?
Carry on.
Is that right? I do think that we ought to ask Cabinet or lobby the Department for Education about this price cap for social workers for children, and then adults will follow. Because until we get that, we're all the 14 authorities of the whole country is still all going to be in the same boat. So I'd like to see a recommendation about lobbying or writing to the DFE to try and get them to progress that issue of capping social workers' pay. And perhaps I also think as well that we ought to ask the question, or ask Cabinet to ask the question of HMRC, when they're going to actually up the 45p rate. Because that's, it's perhaps, if you work in a neighbouring authority where you can go from one end of authority to the other in about 10 minutes, and then you get a county like Shropshire where it takes you 2.5 hours, that's going to impinge on our ability. And at least if we do manage to get a better rate, it won't just hopefully positively impact on us. It will positively impact on other rural authorities as well. I certainly think it's worth doing. That's it, really.
Duncan?
Yeah, just a bit confused and just clarifying what's being proposed. I'm actually talking about capping social workers' pay who are employed by Shropshire Council. Are you talking about capping agency?
No, agency.
Okay.
Yes. So the DFE, what the DFE want to do is they want to put a cap on children's social worker pay. And if they do that, then agency.
It's using terminology.
Sorry,
I just talk to that then, because I don't think it sounds very attractive, but of course, an agency worker working in different councils, we're doing a different role. We don't always have the same roles, even though they're an agency worker. So if you're going to try and put a cap on it, clearly if an agency worker comes to be the statutory director of social services, as happens, they're going to be on a different rate than somebody coming to be a frontline social worker. So it's not going to be one rate for social workers. In between, you've got a whole plethora of managers. In many councils I've worked, some of the main agency staff. And so it's a much more, and I don't disagree with the request, but just need people to understand it isn't as simple as just saying that's the rate for an agency social worker. And I don't even know how the government could enforce it, because we can make it illegal to charge or to pay more than that. I'm just thinking, ultimately we do have to increase the pool of social workers. What's happening at the moment, we haven't got enough social workers, so we have to pay a lot more money. It's blind demand, isn't it? And the people who can pay money to are agency social workers. What we must do as a council and as a caring community is increase the supply of social workers, and that will start to resolve the issue. My own experience, I've seen some fabulous agency social workers, there's Shrewsbury agency social workers, and some pretty awful ones, but I've seen some fabulous social workers and some not so good ones as well. So there's nothing to my mind that's wrong or good about agency social workers. The idea of the government imposing a cap, I just don't know how that would work. I'd want to know a lot more detail about how they're going to get the right level, given all the management change within children's services for this cap. Because if it goes wrong and they set that cap at the wrong level, where do we go then? Because you've denied effectively, you can't get agency workers to do this role because you've set a cap too low. You can't get anybody locally. What I don't want to do is children end up suffering because we've constrained ourselves and just can't get the professionals we need to do the job. You don't cap architects or other professions. You obviously try and do your best, but ultimately we are here to serve children, not to balance the books. And we must make sure that children get the professional support they need. So I probably sound more hostile than I mean. I just don't think we can drift into saying a cap's the answer, give us a cap. I think we need a lot more detail about how that cap would work, and we can ask that detail.
Yeah, but I think coming back to you as well is I think the thing is that there's a differential of about 20% between the agency workers' pay and the social workers' pay. That is quite a big gap, and I think I don't know exactly what the government are planning to do, but I do think at the moment that certainly the agencies are in quite a powerful position, and somehow we need to change the power of the agencies in supplying our social workers.
We've been sucked, and we are doing that by having a long-term relationship with one provider, and I understand that's the work that's currently ongoing at the moment. We don't have to just go out to the market. That's a stupid thing to do. We seek to have a long-term partnership with one agency who we believe, from our own due diligence, is offering us good, well-trained. We manage this as a process. We don't just recruit anyone. And I think, as I understand it, from what's being said, I think it might be useful in future if the Children Improvement Board reported something, because we're having two discussions, one down there and one going here, and I'm conscious that people here have had the benefit of the discussion there, so it'd be useful if there could have been some crossing of the papers. But anyway, it was said there that we are increasing the current agency contract, can't remember the name of the company it's with, to include social workers, because it doesn't at the moment, and I think that's the way forward.
Laura, you wanted to come back.
Just thinking about, both points in terms of the committee's response, perhaps it's more about, rather than, giving them the answer, maybe the request from the committee is to say, these are the issues and challenges that we've got, and this is what it's causing. We want you to review and look at how this is responded to, because it is causing, as a pressure on budgets locally. It will be for the local authorities. It's causing, poor quality in terms of that turnover of staff that we were describing earlier. So I think maybe it's about just reiterating that those are the issues. Over to you. How are you going to respond to that and putting a challenge back at their doors? Because I think you're absolutely right, Councillor. There's multiple risks associated with this, but I don't think we've got the answers here to do that. What our role is to do is to highlight those risks to Shropshire and to its residents, and I think that's what we probably might be the way forward as a proposal.
Can I make another suggestion then? That we actually get a little note circulated to all the members about exactly what's going on with the DFE and children's social workers when Sam's back. So I think that would be perhaps better, so that we understood more fully what's going on, and that could go here and to the children's board as well. Because I think we perhaps haven't got enough detail here, so I'll take that one out.
Okay, Hilary.
Thank you. I take on board what you're saying, Duncan, about the agency stuff, but I think there will always be social workers who want to be agency workers because of the flexibility it provides. So even if there is a cap that's put in, and the difference between what a social worker in full-time employment gets and a social worker who's an agency worker gets is reduced, agency workers will still be available to us because there are always going to be a number of people for their own personal reasons that agency work works better for them. So I don't think by reducing the cap or is necessarily going to be too detrimental, because there will always be agency workers. That would you? Yeah.
Bruce?
Thank you, Claire, for withdrawing that recommendation, because I wouldn't have agreed with it, because I think under 7.17 and 7.18, there is information in that report that says that we're waiting for that technical guidance, and I think that is when there'll be some more, or potentially more opportunity to comment on that technical guidance when we can see exactly what it will mean and the impact it will have on both adult and children's social working. So I think it's far too premature to start writing to DFG and DFE and saying we want this, that and the other, when they've already consulted and we are waiting now their guidance, statutory guidance.
Okay, Kevin?
Right, I mean, when we're talking about capping, we're talking about capping an individual wage, is that right? Yeah. Well,
Agency costs.
yeah. Say again, sorry.
And the agency. So
Right, because I was going to say, maybe it's the agency that should be capped and not the individual. Yeah.
So, are you happy to go with?
Yeah, I think,
Right.
yes.
Sorry, Bill.
You've got to remember, it's not just professionals in what you're talking about. It's also professionals in all the other different professions that we have in this country. And why people are against taking professional people from other countries to come here to work, I do not know. I think it's a disgrace, actually, because they are the people that we desperately need to come and work for us. And if we were paying the right wage, maybe they would come here. But it's not just this profession you should be talking about. You should be talking about people working in pubs, people who are solicitors. Every profession, they're all short of professional people. And that is what's wrong with this country at the moment.
Can't solve it.
No, we can't. But we can maybe with this new government.
The notes I've made, Duncan, you wanted to have a report on the leavers.
Yes,
Yeah.
sorry, I just think we need more data on people leaving, particularly are they going to similar posts? So
The other issue was the impact of the human resource recruiting. We wanted to know the impact, possibly. We'd like Liam back to panel.
And also the leavers when they're leaving, 6 months or a year, and the reason why.
Yeah. To lobby police and HMRC on DBS and possible rate for travel.
Yeah, that's the HMRC.
That's HMRC. Have I missed anything?
I did suggest that if the review of the Shropshire plan's coming up, the positioning of children's services and our aspirations for children should be more highlighted within that, I think. So it's seen as more of a corporate. And I think it is. I'm not saying it isn't, but I don't think it's explicitly seen that way. And make it more visible to our staff and our communities.
Can I just say though, I think it's a mistake to do that for children without adults. And also the Shropshire plan is about people being healthy. So actually I think it's probably already in there, but anyway, that's all.
No, sorry, but
One last one.
yeah, just one last one. It's with people leaving early. I see you've got a new contract with somebody else from September, October. Is that right, Opus?
Yes.
Yeah. Shouldn't there be a clause in that if somebody does leave early or just walks out, the agency is penalised because it's their contract.
We can
Ask a question, can't we? So,
That's a good question.
okay, thank you all for the questions. I'll now go on to the performance monitoring report. Who am I looking at?
let me.
Yeah, NSS, yeah.
Over to you. I'm taking a bit more with the report. So there's just a few points that I really wanted to highlight from it. Firstly around early help. It's really early days, but we're really starting to see the benefit of the council's reinvesting in our early help service. The early help transformation program's now complete, and our new early help structure went live on the 1st of June, 1st of this last month. The impact of sort of the review and changing the way that we work in early help over the last 12 months. Our early help front door went live on the 6th of September, and the early help and support team prior to that was called CHAST, Children's Help and Support Team, which actually sits within the early help within the front door. That has had a positive impact in diverting more and more families away from that escalation up into children's services. We've seen a significant increase in contact of 297%, and our allocations within early help are also increasing. What that's then meant is that we've seen a significant reduction. At the start of the year, we were estimating around about 11% of children up into children's social care. Over the course of the 12 months, we've seen that reduction through actually doing a more robust that initial assessment, and then the support and the package of support around the family post that assessment based on need. We've seen that reduction come down from 11% to 1% escalations by the end of the year. And what we're actually doing is providing more robust and focused interventions, which are resulting in more positive outcomes. The other point that I wanted to make was around our looked after children's numbers. You'll see on the chat that the numbers ceasing are increasing. Our number still remains high, but we're sort of balancing that out with the number of children that are ceasing to be looked after, and we're now above our statutory neighbours in the number of children that are ceasing, and we're more in line with the England average. And the reason for that, there are a number of reasons around that. We've got young people that are ageing out, so they've turned 18. We've got adoption orders. I think we had in the last 12 months over 20 children adopted, that are where the final adoption order is made. And we're also discharging children that no longer need a social worker. So they did need a social worker. We went to court, got an order, and they no longer need that because they're now safe, either with their parents or an alternative order, like a special guardianship order has been made with the carers that they're living with. The other sort of significant input around the numbers ceasing is the council's investment in Stepping Stones, which is our sort of edge of care service. We tripled the size of that last year, up from 2 to 6 teams. And I think it's important to note really that without Stepping Stones and the work that they've been doing, our looked after numbers would be significantly higher. We probably have around about 1,000 children looked after if Stepping Stones was not in place, and we'd be paying a lot more money for our placement costs, because a lot of those children, because of the national shortage of foster carers, we're being forced into utilising more residential homes, and obviously that's at a significantly higher cost. In the last 12 months, Stepping Stones diverted 75 children away from becoming looked after. And they've stepped down 17 children from residential into a family. So the total saving that Stepping Stones have made just in the last year is 4.321 million. That's what that's what it saved at the council. So in effect, Stepping Stones is actually going some way to stabilising our looked after numbers. And just on a sort of separate note to that, we had our Ofsted conversation, which is our annual conversation with Ofsted, 11th of June. 11th of June, I think it was. And I think we felt coming out of it that it was, we were quite open, we were quite transparent in where we are as a local authority. And I think the feedback was really positive. They felt that we knew ourselves very well. They felt that the self-evaluation that we provided to them was an accurate reflection based on what we were also saying to them. I don't know if you want to.
I would just echo that, Janessa. I think whilst it's a robust conversation, it includes a range of HMI, senior HMI in the region, covering education, social care, and early help and early years. They triangulate what they're seeing and hearing across the piece as well, and that's then played back and questions arise from their work to us. But I think, as Janessa described, I think it was a useful reflection for us. It reinforced our evaluations are robust and accurate. We are sharing the positives, but also recognising the challenges and the work that's required to develop and improve those areas. And Ofsted absolutely acknowledge that. We'll come on to the wider positives around attendance, etc., in the report a bit later, but that was certainly recognised. I think that they also saw, back to some of the questions around a one council approach, they reflected to us that they could see that across a range of services. So not just children doing that bit and education doing that bit and adults doing that bit, there was more join up than there'd been previously. So I think that is a positive reflection on the people direction moving forward. And I think, as we've said today, it's an opportunity to build on that and accelerate that even further. But I would agree, I think it was a robust challenge. We came out suitably grilled and challenged, but in a productive way. I think it was fair to say.
Yeah, we've got a new senior HMI, and it was clearly a different focus. Really, it was just clearly about outcomes for children. You know, whatever we were saying to them, it was, so what? What does that mean for children? What's the impact of that? So it was really robust challenge, but I felt that we did ourselves justice, I would say. So our inspection window is now between now and January, because our 4 years we will come to the end of our inspection cycle by January. So we're expecting.
Got to face them again.
Pardon?
Have I got to face them again?
More than likely. So that's just the points that I wanted to raise. So I'm happy to take questions.
Claire, you were first.
Oh, thank you. Thank you, Janessa. On page, I will ask you a couple of questions about page 10 and 11. I know on page 10, we've had a bit of a spike in sexual and emotional abuse. So if you could just explain that. And also on page 11 about the 0 to 3 months, about the babies as well, because obviously that's going to be really important for us. Yeah,
I'd say in relation to page 10, the question that you've raised about that, we don't know at this moment.
Right.
And we know that the spike related to 3 quite large sibling groups.
Right.
So we need to do a bit more exploration around whether that is if it's just a one-off spike or whether it is more of a trend.
Going forward. So when will we know that? Because obviously it's a very worrying trend. Will you be able to tell us at the next meeting?
Yeah.
Okay, thank you.
The end of your question?
No, there was another one.
Oh, right.
Yeah.
The one around 0 to 3s.
Oh, yeah.
The child protection numbers. I think it's been a concern of ours, but for some time, and you'll know that Sonia and Tanya, they did some work with the ICB, the SSCP. They did some workshops last year, I think. So there's been a lot of work with the partnerships around that. And one of the things that's come out of that is the early help, the parenting hubs have come out of that. And it's an area of focus that we will continue to address. We are addressing, we continue to address. We've actually got health visitors now coming into the hubs and doing that early sort of oversight of our nuts, our babies. And so what we would hope from that is that we'd be supporting those families within early help, so that then the escalation into children's social care wouldn't actually happen, because we'd be tackling it at the earliest point.
There was just one other thing on page 26, and it's the theme about the DBS check. I noticed that adoptions are taking a long time, and picking up from what Peggy said about some of the issues sometimes that the fostering and adoption plans have to be cancelled because the enhanced CRB checks aren't in. So I think it just for everyone, it runs through both reports, this need to escalate these DBS checks.
So the issue around adoption taking 2 years, that's from the point the baby's born, comes into care, to the point where the adoption order is made. So that will include the court period as well as searching for adopters. So it's not just a point of this child's placed for adoption, then it's 2 years.
No.
It's the whole process.
Yeah. No, and I appreciate that. And I just think, from the child's point of view, the sooner they are with a loving family, the better. And anything we can do to shorten that gap is really important. So if we can speed up these DBS things, then even if we're talking about a few weeks or a month, it's still really important for the child.
Just tell you on there, we also now do fostering to adopt.
I was just going to say we've got an early permanence.
Family were happy to take the child. Just, I don't think anybody's, when they've done it, it's all gone through, hasn't it? They're pretty certain that this is what's going to be the case. So that child is with the family that's going to adopt it way before everything gets finally settled, which is, it's really worked out well, hasn't it? Really has.
Yeah, but sorry, you said though, Peggy, that fostering was delayed because the DBS checks.
Yeah. Duncan.
Mine's not on this issue, so come back to me when we finish.
Okay, Kirsty.
Hello, I just want to put on record my thanks to the Stepping Stones team. I think, Danessa, you're being quite humble there. The work that they do is phenomenal with families and children of Shropshire. I think the most important thing is, yes, there's a financial implication, but there's a supportive, emotional one as well. They are doing some fantastic groundbreaking work. They continue to impress, and other regions and authorities, Danessa, look to us and go, what is Stepping Stones? Because it's brilliant. So I think you've been quite humble. So can I put on record my thanks to the team? They're absolutely fantastic, brilliant outcomes for children, and the support they give the families for those children returning to the homes. That's the important bit as well. It's not just about the child, it's the child in their home setting, family setting, and it's really important to remember that. So Chair, can I put on my thanks to the team? Thank you.
Thank you, Kirsty.
Yes, Stepping Stones is really good. I've always thought that, actually. But fostering to adopt, have you only just started doing that?
Yeah.
I know, but it's something that you stopped and then you take it up. Well, I came across a couple who started fostering to adopt when they were 60. She'd been a nurse and then he retired. What I liked about it was the way they talked, that they went to the hospital and got the child, talked to the mother, and she said that was the most important thing, was to assure the mother was going to a good new parent or somebody that was going to adopt the child. I love that, is the way she talked, and I hope that's included in all the people that we have that do it. It's important to know that the mother is reassured that the child is going somewhere, And then to adopt children, of course, as I've always said, I adopted 2 girls. But I mean, the thing is, it's important that the children, are secure and everything. But I thought that was a good point about the way they talked to the mother. I thought that was really good.
They also now do an awful lot more. They have that, I don't know what it's called, the box.
Oh yes, did they do all that? The box with
Yeah.
the papers,
Yeah.
and she sat down and made sure that when they moved on to the next person who had adopted them, that it was all moved on with them. They had 17 children altogether, and the last one, she's 5.
Yeah.
So it's very reassuring that people are doing jobs like that.
We've got some really fantastic foster
It
people.
was on a train journey actually.
It's been part of me, the foster panel now for the last 15 years, and I've heard some absolutely amazing stories, and I've met some wonderful people.
Yeah,
I really have.
I'm sure you have.
Yeah. Ruth.
Thank you, Chair. Really good detail in the children's section of the report, and really good to see some of the outcomes. Which is why it's a little bit disappointing to look at the hospital discharge figures, not that the detail is provided, but it doesn't tell it just tells us numbers and just says, it's increasing. What's happening to those people? How many are going into a care setting and sent home for discharge from hospital, but how many of those people are being supported successfully at home? And there seems to be a lack of outcomes on that section. And the same with sensory, which Hilary raised last time. We didn't have much information about people with a sensory impairment. We now know that some people have been waiting 300 days, which, if you're losing sight or hearing, that is significant. But again, good improvements on reducing those numbers, but not on what's happening to people and how they've been supported, which is in sharp contrast, I may say, to the children's element of the report, where there's much more detail.
Yeah, so noted on your comments around the hospital discharge, there are definitely reports with outcomes, so I'll make sure they're included in the next update. What I can say is that we are seeing more people going home than ever from hospital discharges. Our pathway 1 discharges are extremely high, highest they have been probably for the last 5-6 years. And the length of stay is phenomenal. It's down to 1.2 days. So from when the hospital team are notified that someone is ready for discharge, they're moved on within 1.2 days, which is a huge increase. I think it was about 3.6 this time last year. So, the team have really put some clear, efficient processes in place to improve that, which is fantastic. But we are seeing much improved outcomes. Less people going into longer term placements now, and many more people going home. So we'll make sure on the next report you can see those outcomes quite clearly.
And not about the sensory side.
So sensory is a bit of a black hole at the moment in relation to data. So we're just looking at building a new data dashboard for sensory. But there is a very clear, efficient action plan in place around reducing the numbers. There's really strong oversight in that area now, because it was always part of the hospital team. It kind of got merged in, and the hospital always kind of would take priority. But Sensory's got very clear, strong oversight now with a really clear action plan in place, and we're seeing those numbers coming down. They're well on target to support people within 28 days by September, which is the plan. So we shouldn't see people waiting that long from September, hopefully. They're definitely meeting the targets that were set for July, so there's no reason why they wouldn't for September. But again, we can add some outcomes in. Once we've got that very clear dashboard, data dashboard, we can build more outcomes into the reports going forward.
Yes.
It's thanks. It's a fair challenge, and I did smile to myself because probably the hospital discharge is probably the area we've got the most outcomes and numbers and things. So we will take that back and bring that to the committee, and just absolutely just echoing what Michelle said around far more people are going home pathway one, as we describe it, so going home with some support. And a part of that is around the work that we're doing with the system. As you know, on an annual basis, we do the Best Care Fund return. So what we've done, and we, as part of that, there's a demand and capacity piece of work that we've got to do. So as a system, we've agreed that those pathway percentages, as we describe them, so, the numbers that are going to go home with support from home, or might need a bit of bereavement through community hospitals, or all need maybe a bit of care home support. The highest proportion target now is obviously for those to go home. And so as a system, so the hospital are committed to that, we're committed to that, so they're working collectively on that, and it's making a huge difference. As Michelle said, so the length of stay is reduced. Start performance, our in-house bereavement service, as you're aware, really high performing at the moment, aren't they? So they are really taking some more complex individuals home. So I think you're absolutely right. We probably haven't given you probably as much detail as you want, but it's report's so big, it's difficult to pick out those key areas. But we will absolutely do a bit of focus on that for next quarter report. I think it'd be interesting.
Try and come back to Chair. That's reassuring. But if people are going home, which is right, and I see the number of carers going up, is that a direct correlation with when people are going home and there are family carers? Are they the same carers that are being in this data, or is there still work to do with family carers looking after people from hospital when they return home?
It's a good question. I think it could be a portion of some of those carers, because we moved the carers hospital liaison officer from the operational teams into the carers support team, so they are directly doing a huge amount of work. So it could be an amount that's proportional to that, but I don't believe it is. I think it is more to do with the work that the carers teams are doing across the county, and really getting out there and and trying to do some talking about the hubs earlier on, doing meetings out there, to really try and target and get people just to much more awareness raising, I think. So I suspect a small bit, but not a direct correlation, I think.
Laura, does this come into this, the virtual care team?
So the virtual care team, so at the previous, committee, we talked about that. No, so that is the virtual care delivery team. So that is our new system that we've got that sits within our EPOC. And they are supporting people virtually, and some might need a bit hands-on care as well. So that's part of the big project that we're doing, driving forward. So that again is helping, I suppose, in terms of reducing the need for workforce to have to travel to course, which relieves that resource to support hospital discharge or community support. So it's trying in all ways to make sure that resources are directed where it's needed the most, because we know we've got scarce resources.
All right, Ruth.
Yes.
Okay. Claire?
Oh, thank you. A couple of things, Vanessa. Do you promote the use of AI in conjunction with support for staff? Because I know that some of the programmes the council have got now are incredibly good and very helpful. So what do you do around that?
We are promoting the use of AI across children, more so with minuting meetings.
Yeah.
We can't utilise them for assessments.
No.
Or anything that is going into the court arena. We can't utilise that. But where possible, our support staff and with supervision and any sort of internal meetings, we can't be utilising them. Because there is obviously the issue of licences. There's only a limited amount of them. So they've been best placed within our support staff. They're the ones that have mainly got them.
Yeah, okay. So, I mean, it is incredible. I mean, it's very helpful. The other thing as well is that, the reports we had, the pack was enormous. I mean, it took hours to read through it all. And there's some really, really good stuff in the chats paper. But I think it's probably the wrong place to discuss it all here. And also, some of the diagrams in there, and I think then they're national ones, so everybody uses them, are not that easy to understand. So I think that it would be really helpful if we had a separate briefing for all members actually on that bit, so that they could actually understand the graphs, because they're the ones we've got to use. And just have a look through that, because it is a really important piece of work, but it's almost a sort of thing on its own. So if you could,
We'd be happy to do that.
yeah,
Sonia is going to work with Parliament
yeah,
to do a piece of work around that, so that committee has a full understanding.
Because I think it could be really, really good. But I just think that probably we need that briefing just to get our heads around
understand
it.
What you're
and just get our heads around the graphs as well. Okay, thank you, Vanessa. And I think they've all said it before as well, but I think what shines through for all the reports really is just how hard, all the people in adults and children are working, and I think that, and how much pressure you're under. I mean, you can see just how much pressure you're under from reading the reports, and we all think you're doing a great job. So thank you.
Hilary, you were next.
Thank you. I just want to go back a couple of things. One is I just want to really say how good early help is and stepping stones. I mean, I work in that and I can recognise them. It's really good, and I just wanted to put that down. The other thing I just wanted to go back to, and that is talking about the patients and leaving hospital and coming home. And I have a bit similar to Claire, a bit complicated looking at all the graphs sometimes. Have we got anywhere that is saying how well that's working? How long are the patients staying at home? Are we having readmittance? How is that all coming together, and have we got
Yeah. So yeah, we absolutely do. So we report after 91 days from discharge, so how many people are at home, what they're receiving. That isn't in here. Completely know that. It's not. It's not.
And I couldn't find it. And I thought I might have missed it.
Yeah, no, unfortunately, it's not. So we'll definitely, as Laura said, we could kick ourselves because that is one area we've got so much data. So yeah, we'll probably try to highlight other areas instead this time. So we report on that all the time. So we've got very clear how many people are at home after 91 days, how many people are being readmitted on a regular basis. And normally what we've started doing more recently, if we're seeing within a 12-month period someone being readmitted 3 or 4 times, we're then looking as an MDT to say what's happening. Have they got the right level of support? Have they been linked in with the right primary care support? And what do those individuals need? So they're forming part of the new locality MDTs that we're holding to look at those most vulnerable in the community that are kind of in and out of hospital on a regular basis.
Right, yeah, that would be really useful to have if we could.
Viv.
Something I came across a few weeks ago, and I'd never heard of this before. If you have a private operation for a hip replacement, the lady was brought home and dumped in her house, just left. Luckily, she rang me. There was no way for her to go to the toilet. She didn't have a toilet. There was no bed had been put in place for her, and she was left on the settee. So have we come across this before? Are we getting this happening quite a bit? I rang the doctor up, and of course they get the services for it, and got in touch with the social workers the following day. So that's something unexpected happening, isn't it?
It is. Because we would normally know about that person with them having a treatment in a private hospital.
Yeah.
We are seeing an increase actually in people coming through where they've had operations they've gone privately because the wait with the NHS, and then they've got home and they're like, oh, I need help. And quite often they'll come through to the community social work teams, not through the hospital discharge teams, and we'll provide support. A recent example was with a lady, similar hip operation. She'd been home 2 days. couldn't manage with personal care needs. It came through and we managed to get her through to start our reablement service. So she had the same journey that she probably would have had if she'd have had the operation through the NHS. So but we are seeing that.
The woman fell and she had to go back into hospital, not a private hospital, and have something done to her hip again. So that's all extra for the NHS, isn't it? You know, why are people not informed that once you come out of that private service, you're not going to get anything at all?
I mean, generally, private hospitals provide information to patients. I don't believe we do any specific work with private hospitals around providing them with the right contact numbers to ring for support. That's something we probably need to look at if that's going to continue to increase, which it's likely to given the pressures on the NHS.
Yeah. I was utterly astounded that she'd been just sat in a chair and left. You know, it's not right, because I know that our hospital people had to come out after she'd fallen and take her back into a proper, you know, what I call a proper hospital anyway. But I mean, the thing is, I'd never come across that before, and it's just I wondered if it's happening a lot, and you've just told me that.
Yeah, we've seen a few more recently.
Right, thank you. Probably going to get more and more, aren't they? There's more and more people, but you know, they'd rather pay, get relief from the pain.
I think it will, because you're right, with the wait for operations, people can't work sometimes, so they'd probably rather pay privately, and that will potentially have an impact on the demand.
Mind you, the care lists are getting bigger now as well. Getting longer. Ruth, have I got you down again?
Yeah, hopefully. I have some questions on for David, please. 7.73 through to 7.76. So on 7.73, on the families choosing to electively home educate their child or young person, do we do any, I know you do monitoring and tracking, but do we do any analysis of their outcome regarding their GCSE results as we do with schools? And is it any different?
If I respond to that, it's incredibly difficult for us to do that, because the way the monitoring and tracking works nationally is the exam boards submit the results come to the schools share those results nationally. That's a really clear picture. We pull that in from our schools on results area and publication dates. There is no national requirement for any family who are electively home educated to do that. So you'll have heard, I'm sure, in previous months, lots of requests for government to introduce a central register and increase the expectations on families where there is elective home education as a choice. And that would be an example. So short answer is we don't have a lot of data to be able to do that. We have the informal conversations. What we do is we pick up those young people when they are moving towards post-16, and again we support them where we can in terms of those destinations. That I think would be with any challenging person who might be more vulnerable.
Okay, thank you. And then on the 7.75 monitoring of the children missing education, just for background, is that children missing education through fluency, or is it through ill health or absenteeism, or just general?
No, so that's a very specific cohort of young people. So that's a group of young people that are missing education and we're trying to locate where they are, essentially. So they may have moved from an area and we've not received them in area, or they may have arrived and we've known that they've come into the area but they've not been registered in a school, that they are therefore missing education. What we also categorise that group as, so we might have an example of a family where they've chosen to electively home educate their child, and actually through our monitoring arrangements or actually with early health and social care, we deem that to be inappropriate and unsuitable, and we issue what's called a school attendance order. So as part of that tracking work, we would then deem that child is not suitably educated, therefore they are missing education, and that allows us then to follow that more direct route to return them into education.
So I note the rates here are lower than national averages and in line with statistical neighbours. And that comes through one or two of these points. I know the report is large, but occasionally could we have that sort of data, comparison data included?
It's included in the appendix right at the end. Oh, okay. But I take the point. So we try and share. It's right at the very end of the dashboard, and we've specifically included it there actually, so that we keep aware around to it. We are continuing to monitor, and we are concerned might be too strong a word, but we're watching it very carefully. We're concerned with the numbers of young people that are coming out, or families are choosing to move them from traditional education means into home education. There is some national challenges around that, and we could be here a lot longer than we've got today around debating and discussing that. Beyond philosophical reasons, there's some of the work that we're doing with schools and to understand that. We've introduced a change in the policy with the engagement through fair access protocol, that where a young person comes out of the school, electively home educated, if they then return or need to return to school for various reasons, they would return to the same school on norm, because what we're seeing is some movement between schools and almost EHE being used as a way of moving between schools. And that gives us cause for concern, particularly around safeguarding grounds. We also see that where we see young people and families moving between areas and parts of the county for various reasons. And again, we have to keep a very, very close eye on that, because that can often be indications of vulnerability, concern, fleeing various different aspects of challenge that we want to unpick. So we really can focus in that the challenge is simply the numbers and the scale. And you'll see, and Councillor Wilde described, there's lots of pressure in the system, and there is not lots of extra resource to meet that demand. So we're having to really focus and prioritise and risk assess where we are to make sure we're robust.
Thank you for that. That's really clarified my thinking around that. And my final question is around the improvement in the percentage of 16 and 17-year-olds, not in education or training, but the meet cohort. Yes. But is there a difference between rural and urban areas? Because I'm receiving some inquiries and casework now around families who are saying we can't afford post-16 education. It's unfair. My daughter has to do something at 16, otherwise they're categorised as a NEET. And I just want to know if there is really any rural disadvantage, or whether we're doing enough with those rural young people to make sure that they are not disadvantaged and can afford, in many cases, which is difficult, the post-16 travel costs. If I take Bishop Castle, for example, it's travelling to Ludlow, Shrewsbury or Hereford, plus reliance on parents to get them to buses or train stations. And I'm certainly aware of one family seeking grant funding because of that challenge.
It's a really, really appropriate question. So if you look at our data is actually really, really positive, whether you're comparing it to rural or urban areas. I think that's because of the increase in the robustness of our tracking and follow-up and engagement with schools, settings, post-16 providers, etc. I think what you're describing, Councillor, is a very real challenge. Wherever you are in Shropshire, you have to move and travel to get to some degree of education, in particular when you're looking at that post-16 type of provision. The challenge local authority has is we have limited input and influence. So where we look at the state school sector and to a degree the early years phase as well, the local authority holds more regularity, quality assurance type arrangements within that space. When you move from into post-16 and beyond, we hold far less control and influence and QA role within that space, unless a child has an educational health and care plan, then it's a different conversation. So for us, we therefore have influence in terms of conversations and partnership and work we can support, but we can't direct a particular provider to operate in a certain way. And you will be familiar with, I'm sure, the two post-16 school-based post-16 providers that have consulted this academic year to close and will be reducing and closing their operations from September 2024. That exacerbates that challenge. So I think for us, we're really good at tracking, keeping an eye on, working out how we might support, but we are working through ways of trying to develop the public transport network in a different way. And it may well be that given You've got different policies around that may enable more of that work that you see in more rural, more urban areas. So if you look at Manchester or the Combined Authority in the West Midlands, or Liverpool City region, where those areas have got greater opportunity to almost direct and franchise their public transport arrangements, normal standing local authorities do not have that yet. That may well come. At the minute, we are working, as I say, to use our influence with partners to support that. I know a number of providers at Post 16 provide their own transport at a cost of some degree. So again, we're working collectively with them and others to see if there's a way of pooling some of that resource. But it's a really complicated and difficult picture, because we don't control the grip around that. We're trying to encourage, but we haven't got the power to enforce that. Thank you very much. Well, thank you.
I suppose it was really just an opportunity for me to say, this is the quarter four report. This is a really comprehensive report that sets out the broad view of what's happening with the performance across the whole of the People Directorate. And already, I would say you are, as a committee, identifying some specific things which you might want to look at in more detail, maybe at quarter one or quarter two, at the right times of the year. So if you wanted, for example, to look at education attainment, you would want to look at that at a particular point of the year, and that information is published nationally, and that benchmarking is there. So I suppose it is comprehensive, but you have the opportunity to specify what you want to cover in more detail in the report. So I'm sure the officers would find that really helpful, so that they are able to target that on the basis of what you're saying, identifying. So I've already got discharges down, the sensory aspects of it. Virtual care you might want to come back to, because that's quite a new thing which is emerging. Carers and family carers. So that's literally just what I've taken there from the adults conversation. And there's also maybe more you want to pick up on the children. So I would just encourage you to help the officers know where it is you want to get into. And look at in those other reports as well. So, but yeah, a good conversation.
Anyway.
Thank you. Home education, that's all bringing it up, Ruth. I'm aware that there are some schools that do a combined home education and education. So some children go 3 days a week and some go 2 days a week. How many schools in Shropshire are providing that service? Is it just primary schools, or are there any secondary schools? Is it a way that we can be working more with our parents that are opting for home education to encourage them, so that we can keep track and have a... So I'd just be interested to get a bit more feedback on that.
It's a very good question. So what you're describing is called flexible schooling, and it's a wonderful phrase. It's outlined in legislative guidance. It has its own challenges. So we have literally a handful, 1 or 2 schools in Shropshire that do that currently. We are cautious around advocating for it. Whilst it brings some of the benefits you've described rightly, it gives some eyes on directly for a period of the week for some of those young people. What it means for the school is they've got less input, and those young people are part of the community, but only for part of the week. So it challenges the belonging that you want to encourage for a school setting. It can be difficult. We don't advocate for that. We've spoken to schools around the practicalities around it and the challenges and opportunities, and worked with some schools around that, and they've subsequently decided not to move in that direction. What we will continue to do is, I think, work with schools directly around avoiding, where we can, that elective home education choice, and understanding that more deeply and fully from the family's perspective. So whether that's around satisfaction with the offer at school, again, working closely with colleagues in early help, and we've got that work started in terms of that connection between the teams. We run a weekly checking exercise around social care vulnerability status. So again, we're not just looking at the young people that are electively home educated at the point that decision's been made. We keep a track of where they are now, because we can adapt our approach based on that. But the flexi schooling one's an interesting one. Yes, I don't think we'd look to expand it more than that, really. I don't get a sense nationally there's any greater engagement or awareness in it than that, really.
So suggested a couple of primary schools,
Yeah.
the big ones I'm aware of. Right.
Yes, I'm sure it will be.
Yeah, okay. I feel home education will increase nationally, which is why I'm quite interested in that. Conversations how we things
So without a shadow of a doubt, we're seeing the elective home education numbers increase nationally.
yeah.
Definitely, and this is where within any data that we provide, we don't just provide the actual raw numbers, we provide a comparison, because it's always, you can be comparing apples with pears otherwise. So it's really interesting, you can see that comparative rate really. So we're cautious and we're just keeping a very close eye on it. That we're not out of kilter. My ask perhaps would be a big committee. We in Shropshire would strongly advocate for a national register. We can see from national serious post reviews, learning reviews, child review panel, etc., where elective home education has been a really strong feature of serious harm for children and people, and that movement that I described between local authorities, between areas, between schools, and all of that flow in a child's life. So any way of nationally mandating that really clear understanding and having that history would be really, really useful. I think that's the challenge. Even when you look at the definition in law, it's around suitable education. It doesn't specify amount, doesn't specify type really. It's very, very vague. So I think there's lots of concerns around that. And I know the schools commissioner for England has equally described that. It's a really challenging area, I think, really, to move forward.
So schools have a choice then to do the selective
elective home education.
I mean, how does that?
So
they're state schools, so
they are. So the law is really clear that families, so that the legal parent of a child has a legal right to request elective home education for their child. And the schools can raise concerns, and they do, when that is perhaps against their judgment around safeguarding or educational, improvement, anything like that. They can raise concerns. We then do checks. We consult with any help on social care around the wider view. But there are very, very, very few reasons, essentially only safeguarding reasons why a local authority cannot or would stop a family doing that. So to stop it, you would have to essentially move into a social care strategy conversation to determine whether there is significant risk of that family or the child if that happens. It's fraught at the minute with opportunity for risk.
Does this parent just have to send a letter, don't they? Correct. To say they're taking the children out.
It's as simple as that.
Right. Coming back on that, to me, it's the safeguarding part of it, which is shocking.
Which is why I sort of think it's good when they partly go to school, because then you've got the checks. It's not. That's why I'm. If they are going into school 3 days a week, at least they are the checked. But I can see these schools have actually elected to do this.
Yes. There are some children that are absolutely thriving now, been at home, different pressures at the school, if they've been bullying or something like that. And they do that. They really, I'm read on it, aren't I?
Viv, just a quick one to say that I paid for my children for extra lessons because their education was very bad before they came to me. They were shop and change school. So I paid. I got told off. Didn't I get told off at the school they were going to? In fact, I was brought up before the governors. How dare I send my children for extra lessons? But they've both got really good jobs. In fact, Emma's 42 and she picks and chooses where she works. But Liana works in the blind school at Hereford, which is she's got this thing about helping people. So, I don't think I did anything wrong.
No. Can I ask, we're now supporting 9-month-old, aren't we?
Yeah.
We had a big take on it.
Yes, so included in the report, we've given an illustration of where. No, it's absolutely fine. I think we phrased it in a way that says we're encouraged with the early take up from April, but we've tried to keep it to the quarter four. So the short answer is yes, we were above our take up rates were above the regional and the national. We're keeping a close eye. There's a period of time where the expires. So again, we're keeping an eye on that, and we can kind of cross check that. We're doing some wider work within the team in terms of linking it to live birth and NHS data as well, to explore where might the gap be. That we've got this cohort of children accessing some type of provision. We've got this number overall. Why are they not? And would we feel collectively it would be in their interest to access something, and then we can have this kind of wider conversation. So we're encouraged with that. It will bring us some challenges, we know, in terms of sufficiency as we work our way through. Again, it's always difficult within the early years because it's not quite the same as school age. It can be more mandatory as passing as people
I think a lot of people realise they don't get paid in school holidays for it.
And this is the challenge, isn't it? Exactly. And I think, whilst you can split the amount, it is only a set amount. But it's positive. It's a really broad opportunity for families and for young people. We can see all of the benefits, absolutely. And we know we're looking forward to even next year when it goes that much further down to those little ones, really little ones.
Any more questions? Did you say you got a list of?
Yeah, I mean, so in terms of, I suppose it's getting agreement really from the committee that what I've got is what you would like to have a bit more focus on, and then that can be used by the officers. And they'll probably be able to use that actually to know when the right point it would be to bring those into the committee for you to see. So if it is a payment, that'll probably be quarter three report because it hits that.
Sorry,
can I just make a point really? I just think that's to do with the work programme essentially, not to do with what our recommendations for the added value to cabinet. Personally, I don't know what anybody else thinks, but I think that is a work programme thing, which is after this item.
Right. So
what I suggest is that perhaps what I propose anyway, the two things that I think would add value on this particular item is again to mention the DBS checks, because I think the more times we mention that, hopefully the more progress we'll make. And perhaps something around promoting the use of AI in conjunction with support staff. And again, I think that's trying to enable and empower the staff, because I know Danessa said they were a bit short of licenses or something. So I think by highlighting that, maybe we can make it easier across the piece for people to actually have access to that. So there's the two I suggest, but happy for anybody else to add to that.
Yeah, you've been coming.
Yeah.
Further information on I think that's possibly what Tom was trying to get to, the outcomes of some of those areas, sensory impairment and hospital discharges. So although they're not recommendations anywhere else, they are things that I think we would want to see in this report next time.
Yes. Can I just come back, if I may, on that? I think perhaps when we get to the work programme bit, I think it's really important that we have the quarterly performance, information. But what I think we need to do in the work programme is actually, as you say, add focus at different times for different things. Do you see what I mean? So that it will come. But I don't think it here we're making we're basically trying to add value to what we say to cabinet, and so that will add value, but it'll add value after it's been to committee. So it should be in the work programme bit. If you follow me?
I do, but at the moment we've got two halves. One with just numbers, and one with another part of it with outcomes. So we either have all numbers or all outcomes, or
so that's
think
what,
about that report.
Yeah. So that's what we need to do when we ask for what we want in the work programme.
I accept we need further information in the work programme, but I think the report needs to be consistent throughout in its approach.
Yeah.
Because we're not getting if if there are other areas in the work programme that didn't include, for example, sensory and hospital improvement, we wouldn't get anywhere, would we? We wouldn't know what the outcomes were.
No,
Where
but we
we're
could
getting a
ask
very
those to be
comprehensive
included.
picture. And I think, with no disrespect, it might be the legacy of this previous committee being focused on children's. We get a very comprehensive picture on children and education, which is extremely valuable and important, but adults is also the same.
Yeah. I think really from the team's perspective, bearing in mind, it's really difficult to pull together. One of the things that we were asked to do was to pull together the CQC things that we, reported for this quarter. So what you'll see in there from an adult's perspective is the key things that we've highlighted from the CQC. So that's what we were asked to do. That's kind of what's in there. So I think it's really helpful to hear your feedback and to have a really clear, because I can tell you this could have been easily 30, 40 pages more than it is easily, because the data and performance stuff that we hold is vast. So I think the officers, certainly from my perspective, would really appreciate guidance in terms of what it is that you want. Outcomes, taking your point, counsellor, absolutely, making sure that we do both. But areas of focus will be really helpful, because it's huge. I mean, we're looking at performance constantly, aren't we? Whether it's national ones that we're reporting, local ones that we're looking at new developing dashboards. We do deeper dives into things and themes for, there's all sorts of different things. So I think it's linked to the work programme discussion, absolutely. And so perhaps maybe at the end of the quarter ones, perhaps that focus is we can highlight that now and say, for discharge, absolutely next month is next quarter, as Tom has said, that will be, maybe we do that on a quarterly basis. So you've got a bit more richer detail in specific areas rather than a wider scope. Does that make sense? Because what we've given you is quite a wide scope, and it's not even anywhere near to what it could have been, as I said. So it might be worth, if you want a bit more detail in some specific area, but then we're absolutely happy to do that. I think it makes sense to do that. It's really, really difficult. And we take things in and out constantly. Again, it's too much, because it's like 50 pages long. Otherwise, it's huge, isn't it?
Yes.
Particularly for adults and children, as one directorate, the breadth is massive. So, yeah, I think so.
I think there's some middle ground around, twice a year we get the outcomes for the children's element, and twice a year on the adults, so that there is a sort of a view across all. Because asking about sensory, for example, last time Hilary has identified some quite serious concerns, I think, the numbers and wait times, and I'm sure if we were to do something more on children's mental health, we'd have similar concerns. So I think maybe splitting the level of detail between the adults and children could be alternate quarterly report.
But the only thing is, though, Bruce, we only get 4 meetings a year.
I know.
And what concerns me is that you're not going to be looking at kids for 6 months or adults for 6 months if you do it like that. Which is why, for instance, when we have the performance reporting, we see it all. So, for example, we could ask when we get to the work programme if on the next meeting we actually look at discharge data, and we also look at academic attainment as well. So we pick 2 bits out to have, along with keeping our eye on both adults and children's. Especially given the financial pressures that the council are under, I think as a scrutiny committee we have to have sight of both.
I think we definitely need more on sensory, because I mean we just got a very small paragraph this time. I think we could, and because it's been so bad, we really do need to have. No, you're expecting by September, but that would be great if the next time you're able to confirm that, and we get a little bit more detail about the different types of sensory and how it's done.
And if we do have the Ofsted in January, we really want to know about that, definitely, don't we? Yes. Sorry about that.
So, right. Everybody finished with that report? Oh, no, you want to come back on one.
It's a slightly ancillary issue, but we've talked a lot about DBSs, but this council has had a letter from the previous minister urging us to apply DBS checks to any councillor who's on a body that deals with vulnerable adults or children. And to my knowledge, that's never been discussed. And I think in terms of due diligence and proper governance, we need to just raise that, probably with Tim McCollard, and just say, well, what's happening with this? Because
Well, I've been DBS, I've been paper.
I know you may have been, but I just saying the council needs to decide, and we're coming up to the election period, isn't it? Whether it's going to comply with the advice, it's only the advice of the previous minister, in order to have enhanced DBSs for people who are counsellors on bodies that deal with vulnerable adults or children. And I'm not, I probably would say it's a good idea, but I'm just trying to say, I'm not trying to say let's make a decision now. I'm just trying to ask us on Tim Collard to say, where are we on this? So, okay?
Yeah, everybody.
What Claire's saying is quite right, but we need to have just that, what we've had today.
I mean, I think
An open view, but certain points that are brought out a little bit more.
And you know, and I think as far as Duncan's point, actually, we could ask that now, because I thought we all had to have enhanced DRB checks to be counsellors. So maybe we should get a reply from Tim Collard now, you know, email him today as opposed to wait until the next meeting.
I don't think ever had an enhanced DRB check.
We used to have in 2009, I know we did. We used to do the visits, didn't we?
No, I wasn't there 2000.
I don't think anybody
I wasn't there 2000.
And whenever we did our visits, I'm sure we had to have those, yeah.
You were, weren't you?
I didn't.
No,
You seem to have been here a long time.
It's because I talk too much, isn't it?
So just to be clear, we've got two added values, have we?
Yes.
Well,
Right, being as it's just the work programme left. Thank you ever so much for your patience today and for answering our questions.
Very
It's
interesting.
been really good to see you all.
Oh, thank you.
These things.
Yeah, you've been staying.
Yeah, you helping me.
Yeah, probably split. Yes. Very well done.
Five. Right, work programme. Over to you.
Thank you. So you've all seen the high level work programme. It is set out slightly differently to how you've seen it before, but it's very similar in terms of its principles. So each item has been identified as either being a briefing, and that is an all member briefing. It isn't just for this particular committee, it's open to all members to attend, but they do feed into the particular topics that the committee had raised and that they were interested in. There's then a briefing and then a decision whether there's further areas or topics of interest for the committee. So again, the same, the briefing is absolutely open to all members, and it's then for the committee to discuss whether you feel that's something that needs to continue forward. And then there's some items that have been identified, such as performance reporting, that will come straight to committee. With that said, because of the nature of how Overview and Scrutiny is working now, it will still be valuable at times for the committee and all members to receive briefings ahead of this. So that's why you'll see some topics repeated, because there's an earlier briefing that is then scheduled ahead of time for you to have the opportunity to reflect, perhaps seek other information, to be able to triangulate evidence that will then feed into a later committee meeting. I won't go through each of the individual ones because there has been the opportunity to review it. The thing I would just stress at this point is it is, as it has always been, iterative and is likely to change, as has already been highlighted with the outcomes of inspection reports such as the CQC and Ofsted, which the committee would obviously want to see come here. So that would then mean that it be reprioritised and changes made to what comes when. I think at that point, then I'll probably hand over to Tom to just finish off that discussion from before.
Can I just say, we do an awful lot on children's, but do we do enough on adult social care?
I've got down carers and family carers here. I think that's what you said, wasn't it, Tom? I really think that's important.
I personally don't think we do. I think that's evidenced by, particularly on the sensory side, but note on the report that there isn't anything around transition from children to adults. And I think that's something that we would be considering, and I agree with it. More information around carers and about the review, Because numbers are increasing, which is very positive, but again, it's back to those outcomes, so ratings people are getting. We call them a repairer, but did it stop there or is there anything else happening?
So we can pick out transition part of the learning disability and Northern development, so we can maybe pick up.
That's going to be on my next question. That's huge if it is, isn't it? So will
Well,
there be
that
some,
November is very huge.
so will there be some subsets around learning disability and autism?
Yeah,
I mean, it should include transition in my view, but
yeah.
But I mean, if need be, we can go on a little longer. We've done it before, haven't we? You know, this is important to us. Well, I won't go to the 4-hour one. We had that once, but you know, a bit longer wouldn't hurt. We can have a break and then come back to it. Because we didn't do adult social care before. We've just come into it this time. So I think, you know, there's more there that we can explore.
So are we going to put the performance data on discharge into the next lot of figures? Is that how we're going to deal with that one? Because that would make more, because we mentioned that, didn't we?
Yeah, so I think I've taken it to note that we'll focus a bit more on the next quarterly updates on sensory and discharge. We'll do a bit more in-depth detail on that and maybe take a few other bits out.
we've got education outcomes anyway on that November.
Yeah, exactly. So try not to duplicate some of the things on that. The other thing is the commissioning update. I can do that as a briefing at any point to members. Like, it's just a general update. What we do in terms of the performance anyway, and some of those key areas are commissioning. So they're specific commissioning areas, but I can do an overview at any time if that's better, just to take that off. And then you can maybe have that in advance in terms of the way we're trying to go, and it will help inform maybe November. So I can maybe do that in advance of November session, like, as we were saying, to give you a bit of a broad understanding of some of the work. That helps.
I like the idea of a briefing, because then more members have got more of an idea of what's happening in the council.
Yeah, and I do think as well that I don't think we ought to bung it up too much, because once we've had the briefing on the chats and once we've had the briefing on commissioning, I think when we've had a really good briefing, we'll pick a couple of issues out of there. So actually, I think that's what we ought to do. We've got the next one sorted, so let's have those 2 briefings and see what we pick out of there, because I'm sure there'll be things come out of there, because there's such huge pieces of work. That'd be a suggestion.
Everybody okay?
Yeah.
Date of next meeting then is Wednesday the 27th of November.
Wow. Okay, thank you. Well done, Laura. Thank you, everybody. Stepping into thought notice. Oh. Right. See you, Peg. See you, all right.
I don't think any coffee.
All right. It's a pleasure anytime.
It's all right. It's gone. Yeah.
It's all right.
It's all right.